Hello, everyone. This is Valerie. So today we'll talk about pregnancy and oral health. So pregnancy is a unique and important period during a woman's life, and it's characterized by complex physiological and anatomic and hormonal changes, which may adversely affect oral health. During this special period, it is vital for pregnant women to pay attention to their oral health as well as their diet, as it directly affects their overall health and the health of the fetus. So what do you need to know? You may ask, can I receive dental treatment when I am pregnant? If you can, schedule any major restorative procedures before pregnancy. And then the second trimester is the safest time to provide dental treatment. It is the best to receive any routine treatments during this period. Complex and elective dental care is best deferred until after the baby is born. You may also ask, are dental x-rays safe? Yes, oral x-rays is safe for pregnant patients. Modern dental x-ray with the lead abdominal shield expose the patient to lowest dose of radiation, which is focused far away from the uterus. But if x-rays are not needed, do not take them. Only x-rays necessary for diagnosis will be obtained. You may also have the concern that are dental medications safe? And I can see most dental medications are safe to take while pregnant. If you want to take any medications, always consult with your physician before taking any new medication or stopping the ones you are taking. And for the antibiotics, do not take tetracycline. It will cause discoloration of the baby's teeth, and also concerns with nitrous oxide sedation. So for the common oral health concerns during pregnancy, the most common dental concern during pregnancy is pregnancy gingivitis. So what is it? It is your gum to become red, puffy, and inflamed. It can also trigger bleeding gums when you are brushing and flossing, and mouth sores, and persistent bad breath. It is usually harmless unless it is left untreated. Most 50% of all pregnant women experience it. If a pregnancy gingivitis left untreated, it will progress to periodontal disease. It destroys the bones, fibers that help to keep your teeth in place, bleeding from the gum, tooth loss, and infection. An increased risk for both preterm labor and having a low birth weight baby is associated with this periodontal disease. Okay, then we will talk about the dental disease process. The raise in your hormone plays a role in your developing pregnancy gingivitis. This higher level hormone leave your gum and teeth more sensitivity to the bacteria that hide in plaque. This is one reason why gingivitis is so common in pregnancy. And sticky plaque that accumulates on our teeth and gum, it can leave your gum swollen and tender and even cause them to bleed. Gingivitis can also make brushing and flossing extremely painful. And gingivitis is the earliest stage of gum disease, and it is reversible. If you leave it untreated, it can cause irreversible damage to your gum and teeth, aka periodontitis. So you can see the pictures here. So this is a healthy gum and a tooth. And then if you progress to the gingivitis, you will have inflammation on your gum, but not on your bone. And when you go to the periodontitis, you will have pocket and moderate bone loss over here. For the advanced periodontitis, like severe bone loss and deep pockets, and like tooth is in danger of falling out. So now I'll talk about dental caries. 1/4 of women of productive age have dental caries. Pregnant women had a higher risk of dental decay for several reasons, including increased acidity in oral cavity, sugary dietary cravings, and limited attention to oral health. Dental caries is caused by the action of acid on the enamel surface. The acid is produced when sugar in foods or drinks react with bacteria present in the dental biofilm on the tooth surface. The acid produced that leads to a loss of calcium and the phosphate from the enamel. This process is called demineralization. Early caries appears at a wide demineralized areas that later break down into brownish cavitation. So for the many pregnant women, they have morning sickness. It will cause acid erosion. It plays a small role in contributing to pregnancy gingivitis. Many women find that they can no longer stand the smell or taste of toothpaste, making it difficult to maintain good oral hygiene. Vomit contains stomach acid, which can eat away at your gum and the teeth, making your mouth very sensitive. So what you should do not brush right away, okay? Rinse with water first, or you can use a sodium bicarbonate rinse and chew gum. Like you can chew gum sometimes to like which containing xylitol after eating, and use a soft brush and a low abrasive fluoride toothpaste to prevent damage to demineralized tooth surface.
So hi everyone, this is Talika and I'm going to be continuing the PowerPoint. So I'm going to be talking about fluoride. Fluoride is like a vitamin for teeth and makes the teeth stronger and harder. It can cover the exposed dentin and bring down the sensitivity to prevent injury to the dentition. Fluoride varnish can also be applied at your dental office and it helps to bring down the sensitivity as well. Home care, you can use a toothpaste that contains fluoride, and Valerie is going to show us what a toothpaste with fluoride, the common brands available in the market. One of them is the Colgate toothpaste, and many other brands, most of them offer fluoride. And another way that you can include fluoride in your for your teeth is by drinking fluoridated water, which is normally present in your tap water. So now I'm going to talk to you about what you can do about dental disease. So if you notice any of gingivitis symptoms, it is important to seek dental treatment as soon as possible. Your dentist will scale your teeth using a variety of instruments, and this will remove excess plaque from your teeth and around your gum line. All pregnant women should receive at least 2 thorough dental cleanings during pregnancy. Maintaining a good oral hygiene routine will also help keep your gums and teeth healthy. You can brush twice a day and always use a soft bristle brush. Floss once a day and avoid eating large amounts of refined sugar. This will cut down on the plaque and tartar buildup in your mouth. And use a fluoride mouth rinse without alcohol, which Valerie is showing us right now.
So you can see when you go to find this fluoride mouth rinse, always double check it said 0 alcohol on the bottle.
Thank you, Valerie. And then also remember to visit your dental hygienist on a regular basis. So if you happen to visit the dental office, you have to be very careful about your position on the dental chair. So if you are in the laying down or the supine position on the dental chair, the weight of the developing fetus can bear down directly on the major blood vessels, causing blood disruption in the blood supply to you and the baby. So if you lay down on the left side, it helps to release the pressure on the major vessels. You can also use a cushion to elevate your right hip to displace the uterus to the left side. So now I'm going to talk to you about pregnancy tumors. The pregnancy tumors are also known as pyogenic granulomas, and don't freak out, this is not a tumor, but it's just a growth from your gums, which also occurs in men and non-pregnant women. It is not cancerous or dangerous. This happens because the changes in hormonal levels during pregnancy and interference during eating can happen, and it might contribute to inadequate nutritive intake for mother and baby because of discomfort when chewing. It also provides a site for bacterial growth and potential development of periodontal attachment loss and eventual bone destruction. So what that means is, because it's a huge tumor and it's kind of covering your tooth, there could be plaque deposition around that area, and that could make things worse because you're unable to clean that spot, and it might just lead to gums getting inflamed as well as bone being lost in that area. Then there could also be bleeding and pain, and it normally resolves itself after pregnancy when the hormonal levels go down. And if it does not, then you can visit your dental office, and the dentist might need to do surgery to remove it. So now I'm going to talk to you about the brush methods, and I'm going to show you how to brush, and Valerie is going to be giving you the instructions.
Okay, now we'll talk about the tooth method. So you can see Talika's video here. So the first, you need to place your toothbrush at a 45-degree angle to the gum and gently move the brush back and forth in short strokes. Brush the outer surface and the inner surface and the chewing surfaces of the teeth. To clean the inside surfaces of the front teeth, you should tilt the brush vertically and make several up and down strokes. And brush your teeth twice a day in a soft bristled brush. And replace your toothbrush every 3 or 4 months. And or sooner if the bristles are fried. A worn toothbrush won't do a good job of cleaning your teeth. And make sure you use fluoride toothpaste. Okay, and then we're talking about flossing. You need to use the string floss. You can use string floss. You can see Talika is showing you the string floss right now. So you should break off about 18 inches of floss and wind most of it around one middle fingers, and wind the remaining floss around the same finger of the opposite hand. This finger will take up the floss as it becomes dirty. Okay, and then you need to grind the floss gently between two teeth, and Talika will show you how to make make a C like between the teeth. You need to wrap the floss around one tooth by forming a C, and move the floss up and down at least 3 times. There might be some bleeding initially, but you will get it better as you floss regularly. Okay, now we'll talk about the plackers. You can see from the video, we also call it a floss holder. It is very convenient. I can bring it with you.
You can choose whatever
you want
to use.
You can use it after
but
at
meal,
least you have to use 1 time per day.
So now I'm going to be talking to you about good foods versus bad foods. Certain foods can damage your good dental hygiene, specifically foods which are sugary may endanger your oral health by creating plaque buildup and eventually tooth decay in your mouth. Just as you seek out good foods, avoid unhealthy foods like sugary drinks, jams, cookies, candies, and cakes. Foregoing these sugary foods will prevent too much plaque and tartar from forming on your teeth and will prevent the development of oral diseases. Some of the foods that you can eat is oatmeal, yogurt, beans and lentils, lean meats, avocados, nuts, and leafy greens. So now I'm going to talk to you about infancy oral health. So once the baby is born, the focus shifts to the oral health needs of both mother and child. The next section, we will address infant oral health and parental guidance through the first year of life. To optimize infant oral health counseling begins during the prenatal dental visits. It is recommended that an infant receive a dental examination at 12 months or by the eruption of the first milk tooth. The dental caries is a contagious disease, and it is an infectious communicable disease initiated by microorganisms in the dental biofilm or plaque, which collects on the teeth when oral self-care is inadequate. So how to prevent dental caries in infants? Avoid sharing foods and drinks and spoons or cups. Avoid testing foods before feeding them to babies and avoid cleaning off a pacifier in the parent's or caregiver's mouth. Never put your child to bed with a bottle or food. Use soft washcloth to clean the newborn's gums, and do not use a bottle or sippy cup as a pacifier. Teach your child to drink from a cup as soon as possible. Serve juice only during meals or not at all. Check to see if your water is fluoridated. And finally, make an appointment to have your child see the dentist before the age of 1 year. So in a nutshell, eat a healthy diet with a variety of fresh and fruits and vegetables. Maintain an optimum weight during pregnancy. Practice good and regular oral hygiene. Rinse your mouth with water after vomiting and do not brush right after vomiting. Schedule an appointment with your dentist for a checkup and dental cleaning. And so this is the last slide, which includes the brochure that we have for you today. And this gives you information about how to 4 key strategies to keep your mouth healthy, and a little bit about the diet. It includes a picture from My Plates, which shows what foods to include in your diet. It also tells you briefly about dental care during pregnancy and that it's safe and it's also important, and the oral care regimen that you should follow every day.
Okay, that's the presentation today. Thank you so much for listening. Have a good day. Bye.